State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to State Circle. Coming up this week, Attorney General Brian Frosh on the very latest coronavirus scams. And we'll see the very special ways that Marylanders are saying thank you to those on the medical front lines. First this week, the latest coronavirus death toll number in Maryland, 171. That is 4 times what it was this time last week. Governor Hogan is urging Marylanders to enjoy this holiday weekend, but to continue observing social distancing rules.
There have been other times in our history that events and conflicts have prevented us from celebrating holidays in the way that we're accustomed to. The way we celebrate this weekend will be very different, but that in no way should diminish the promise of Easter, which celebrates a resurrection after a period of suffering and sacrifice. Easter really is a day of hope, which is something that all of us could desperately use right now.
The governor is sending reinforcements from other agencies to help process the record 100,000 unemployment claims that were filed this week. The state is now reporting the racial breakdown of virus cases. It shows a disproportionate number of African Americans are affected. And an 18th resident of the Pleasant View nursing home in Carroll County has died. Over 100 residents and staff members there have tested positive. Joining us now is Joe DeMattos, who's president of the Maryland Health Facilities Association. Sir, thank you for your time. What are your member nursing homes and other facilities doing about this virus?
Well, Jeff, thank you so much for having me on this evening. We've really been a front on the COVID-19 war since February. And in February to early March, the war on COVID-19 in skilled and nursing and rehab centers in Maryland and on assisted living campuses was a defensive war. We worked and did everything we could to slow the entry of COVID-19 into our centers. When we met with Governor Hogan on March 10th, we advocated for a visitation ban, which he ordered. And that was, I think, very successful here in Maryland. But on March 15th, when we had our first case in Elkridge, our war against COVID became an offensive one here in Maryland in nursing homes.
And of course, it's a doubly dangerous situation because so many of the residents are either elderly or have pre-existing health conditions, which make them more susceptible to the virus.
Yes, that's absolutely right. The reality is that in other states, the residents and patients in Maryland's skilled nursing and rehab centers would be in hospitals. They suffer from multiple clinical comorbidities. About half of them have Alzheimer's. And really, it's the safest place for those residents and patients to be relative to their health. The rub is that COVID-19 attacks more vigorously people with those pre-existing medical conditions.
The staff members at these institutions have all been ordered now to wear personal protective equipment, masks and gloves and so forth, but we know those things are in short supply. Are the people on the front lines there able to get the protective equipment that they need?
Well, here at HFAM and our members have been scouring the planet for PPE for weeks now. And right now, people are getting what they need. But one of the things that COVID-19 for our country, it's shining a bright light on the fact that we're not set up for this type of national healthcare emergency where we need broad supplies of PPE. And the irony is that, of course, that the one region in China that exports this PPE to the United States is the exact same province where this virus originated. So in December and January, when this province, Wuhan, would have been supplying and manufacturing product to send to us, they weren't. And then when we were in prime time for this now, we have a shortage.
Your reaction to the governor's order creating strike teams to go into facilities that have difficulties?
Well, we support strike teams. Really, the reality is this is a multi-front war. We will see increasing activity in the coming days in Maryland hospitals, and the governor's team have done an extraordinary job preparing hospitals for that surge. Hospitals won't be able to manage that surge without skilled nursing and rehab centers as partners to discharge people when it's clinically appropriate to do that. And so the strike teams are an important step in that. They're meant to go into a center for hours, maybe a day, get things on the proper standing, pull back on an emergency, and then allow folks to operate more effectively.
What are the best practices in these homes now in terms of how they should be operating? Should they be trying to send people home to their families where it's possible? Is that a bad idea? Or how are they supposed to be dealing with cases of suspected coronavirus in terms of trying to isolate people?
Right. Well, last week on Friday and Sunday, in a series of orders, Governor Hogan ordered skilled nursing and rehab centers and assisted living campuses to have observation units and isolation units. And so that was stepping up the infectious disease protocols that were already in place in nursing homes, things that we were preparing for. So in terms of receiving patients, whether they're COVID positive or not COVID positive, in the surge, we have to assume that everybody may be COVID exposed. So these isolation units and these observation units are incredibly, incredibly important. Where it is safe, clinically, in a non-COVID world or in a COVID world, people will be sent home if it's clinically appropriate and they don't risk spreading the virus.
That facility in Carroll County that had so many fatalities had been given a 1-star rating by the federal government for allegedly being understaffed. My question is, do we have, in this industry in Maryland, is there a regulatory deficiency? Do we have a quality issue?
I don't think as a sector we have a quality issue. What happened in Carroll County was devastating. I don't wish it on anybody, any family, any person in the world. I do think that was a unique case. There have been media reports about the fact that the medical director at that specific facility may have been fighting the virus himself. And so they had a facility that was in a really tough spot with no physician oversight and a physical layout that wasn't representative of most skilled nursing and rehab centers in Maryland. So when you put together the lack of a medical doctor in place at the heart of the crisis and a physical layout that lent itself to the spread of the virus, it really was a perfect storm. And I don't wish that on the world. In terms of oversight, we have outstanding oversight in Maryland with the Office of Healthcare Quality, who are both our regulators, necessarily so, and our partners. And I think Marylanders can rest assured in that regulation and in that partnership.
Joe D'Amatos, Maryland Health Facilities Association, thank you very much. Now MPT's Sue Copen on an effort to say thank you to all frontline healthcare workers.
While we try to stay safe in our home, there are thousands of medical professionals and first responders who are putting their lives on the line every single day in the battle against COVID-19. But there's a local effort underway right now that's intended to let those warriors know their efforts are greatly appreciated.
What we could do is take pictures of all of them. That way people could submit them, from wherever they are. And we could use them on social media. We can make a video to play inside the hospital with these cards.
Young artists are encouraged to join in the project, but it's open to adults as well.
If people want to send in a card, what we ask them to do is have your child or yourself draw a picture, use a piece of artwork that's already on the refrigerator. You know, a lot of us with young kids can repurpose some of the things that we have just by adding a special message of thanks.
Among those contributing their thanks, Harford County resident Courtney Gantz and her daughter Sadie and son Eli.
Let me first ask Sadie. Now you have your card there, do you? Can you show me it? There you go. Okay, so what did you think when Mom said, hey, I've got this idea?
I thought that I was going to because I like doing stuff for people just because it makes me feel good.
And what do you know about what's going on with all these doctors and nurses and hospital techs and all those first responders? What's going on there?
They can't go home to their family, so that's why people are making cards for them to help them, to make them feel good about what they're doing for all those people at the hospital.
They really understand this project. They understand what our doctors and nurses and respiratory therapists and even the security officers in the hospital, everybody that's going in there to keep the hospitals running, are playing a major role right now. And we should thank them. We should encourage them.
And encourage them, they do, with virtual cards with a big impact from the power of 2 little words. Thank you. Sue Copen for MPT News.
Now, with schools closed around the state, students are getting up to speed on home learning, as Nancy Yamada tells us. Maryland's Attorney General is warning about scams connected to the coronavirus. Joining us is Attorney General Brian Frosh. Thank you for being with us.
It's a pleasure, Jeff.
So the federal government, of course, is sending out a lot of money to people, and, you know, the scammers see an opportunity.
Absolutely, they do. This is prime time for them. We've got a public health crisis. They're looking to exploit it in every possible way. People in Maryland need to remember that there are folks out there, and lots of them, whose sole job it is to steal your money. And they're at it regular work day. They're on the phone, they're on email. And so here are a couple of scams that we know about. People are selling cures. There are no cures for the COVID-19 virus, not yet at any rate. People are selling tests. They offer to sell you tests, mail them to your house, send them to your house, sell them to you on the street. This is a fraud that it can't be done. The only way you can get a real test for the virus is to get it through a physician. So don't fall for that one either. And the government's planning to send everybody checks. They're not going to call you on the phone. They're not going to ask for your social security number. They're going to send you a check. So if somebody calls up and says they just want to check some details, they need to know your birthday, your social security number, they're trying to steal your identity. They're trying to loot your bank account. Don't fall for that kind of stuff.
What's the best way for people, if they're suspicious about something, to figure out if it's legitimate?
You can call the U.S. government directly. If someone sends you an email and says, call this number, click on this link, it's likely a fraud. But just to be sure, if you think that Social Security or IRS or Treasury has something to talk to you about, pick up the phone, look up their number, the real number, and call it. Or, look their email address up and send them an email. But don't respond to people over the phone. If you get somebody on the line who claims they're from the government and they need to know X or Y, you can say, thank you very much. I'll check it out myself. You can hang up on them and then call back yourself. Look for the real number.
One of the other concerns for your consumer protection people is price gouging. A lot of things in short supply, toilet paper, as crazy as it is. What are the rules on what stores or entrepreneurs can charge for something that has actually gone up in value?
So Jeff, until a couple of weeks ago, Maryland had no law that prohibited price gouging, even in an emergency, a public health emergency. So the General Assembly on its last day passed a bill that gave the governor the authority to declare an emergency and prohibit price gouging. And he did that. He did it at the beginning of this month. And his order is broad. It prohibits price gouging in all the areas where you're seeing about it and hearing about it. Food, medical supplies, sanitizers, cleaning products, etc. Our office has the authority now to prosecute price gouging, and we've received hundreds of complaints, and we have issued more than 100 warning letters to retailers, to sellers, who it looks like are charging much more than they were charging before this public health emergency. The governor's order says they can't increase their profits by more than 10%. So you can't tell just from the price increase itself whether there's price gouging going on that violates the law. But we are investigating complaints. People can get in touch with our office. You can go to our website, marylandattorneygeneral.gov, Maryland Attorney General, one word, .gov. You can call us at 410-528-8662, 410-528-8662. And our people will look into whatever price gouging complaints that you have.
You wrote to the governor this week, I think, on the subject of coronavirus cases in prisons. What would you like to see him do?
First, let me say that the Department of Public Safety and Corrections has been doing a very good job in addressing this problem in a very dangerous environment. And the administration has been on top of it as well. We think the governor can exercise his powers of commutation, parole, and pardon in a way that will make these prisons safer than they would be otherwise. It's not an ideal situation by any stretch of the imagination. But if you've got nonviolent, elderly prisoners who are not a threat, who can be released early, it's something that really needs to be done. Their lives are in jeopardy. The lives of the other folks in prison are in jeopardy. And the more people who are in our jails and prisons, the more dangerous it is, not just to them, but to the rest of us, because there are folks who have to go in and out. The corrections officials, vendors, they have to come in and out of our jails and prisons. And they can pick up the coronavirus and carry it out, or already have it and bring it in. And it's a very, very dangerous situation.
What's the situation for people in Maryland who have financial obligations? I'm thinking of two things. One, they have a gym membership, fitness club of some sort, where it's a continuing contract, but the place has been closed down. Second, you're renting an apartment, you have to pay the rent. I know the governor has banned evictions temporarily, but you still have to ultimately pay the rent, right?
Yes, that is right. So we'll start with the renters first. The courts and the governor have stayed evictions for the duration of this pandemic. It gives people some immediate relief. It's not a complete solution. We hope that the checks that people are getting from the federal government, that the enhanced unemployment insurance will help. The problem with unemployment insurance, of course, is there's a lag time between the time you lose your paycheck and the time you get a check from unemployment. But we hope that those payments will help people catch up on their rent once the pandemic is over. But the Constitution prohibits the governor or the General Assembly from just saying, okay, you don't have to pay rent. With respect to health clubs, the governor's executive order shut down health clubs, sports centers, et cetera, and they are not allowed to charge while this executive order is in effect.
Mr. Frosh, thank you very much.
Jeff, it's great to be with you.
Now MPT's Nancy Yamada on how remote work and remote education are making many homes very busy places.
With school kids at home for the next month, at least here in Maryland, parents are dealing with this new reality. We wanted to get a glimpse of how things are going for families. Joining me is Jamie Thomas. She's a mother of 4 and she's teleworking, still trying to work from home as her kids are trying to do their school assignments. Jamie, tell us, how many kids do you have? What do you do? And how are you navigating through all of this?
I have 4 children. I have 2 girls that are in college. I have 2 boys, one in middle school and one in elementary school. We are all trying to telecommute at the same time. That is a big struggle. I am a part-time bookkeeper for a local church. I am doing 95% of my work from home. So we are definitely trying to schedule time, especially with internet access and resources and just room in the house for people to spread out and get their work done is becoming very challenging.
Absolutely. And I know I'm a mother myself, and I know that the platform, for instance, that Frederick County is using, and you're in Frederick County too, the platform that they're using, Schoology, it keeps crashing, right?
It does. It does. And it's very frustrating. And thankfully, FCPS is being understanding about it. The teachers are understanding the issue. They're extending deadlines. They're trying to work with us. They're giving us suggestions like downloading things at off-peak hours, working on them, and then uploading them later. So trying to work through all that and get my job done, it's stressful.
Absolutely. Do you feel, now, can your kids do this work independently, or do you have to sit there and actually help them, and which makes things a lot tougher?
Yes, one of them is the youngest one, actually. He's pretty independent. He's very good about getting up and he's usually done by noon. My middle school child is the one that I struggle with, and I need to be on him and sit and help work with him. The 2 college girls, they're on their own. They're pretty much self-sufficient.
So are your college kids, they're still doing work too, or are they done for the year?
No, they're still doing work too. They basically came home over spring break and never went back, but both the colleges that they go to are continuing classes through the semester online.
And what has that been like for you to now have all your kids under the same roof again? And let's be honest, you also have the pressure of meals, keeping the house clean, keeping the younger ones on schedule. What has this been like for you personally?
It's a very stressful time. I get frustrated. It seems like we're tripping over each other. I'm trying to maintain the house and the meals and the dishes, but some of it, I refer to it as the house is on autopilot right now. Because although we're all home all day, we're all off in our own different directions doing our own thing. Trying not to trip over each other. And I'm getting spread a little thin trying to get it all done.
Well, I can identify with a lot of things you've said. Jamie Thomas, thank you for your time. Best of luck to you, and hopefully we can check back in with you again.
Okay, thank you.
And now MPT's Charles Robinson looks at a pair of professions where public contact is part of the job.
My name is Reza Modaris. I'm a periodontist, or dentist.
Let's talk about what life has been like since you've been on quarantine.
It's crazy, to say the least. We are mandated to see only emergency patients, but then seeing emergency patients is difficult because it all depends on how you define the emergency. But I think that now ADA is much more clear on what is defined as an emergency. Basically, anyone with swelling, cellulitis, severe pain, those are considered emergency. Otherwise, they're much stricter now.
Okay.
If you think his world is upside down, imagine if you're a performer or a singer. Mesa Leak literally travels the world. This has been really a trying time for you. Talk to us a little bit about what that's been like.
To have all my shows canceled at one time, I would say 12 to 13 shows have been canceled. Not even, some postponed, some outright canceled. And it's difficult.
The singer is fortunate. She embraced a lot of new technology like Facebook Live. She decided to use her knowledge to make good on a promise. Where was the concert supposed to be, and then you ended up doing it at your house?
Yeah. It's the Lincoln Theater in Columbus, Ohio. It's one of the oldest Black-owned theater in Columbus.
These are just two of the many in our area who are juggling the rigors of surviving in a pandemic world. I'm Charles Robinson for State Circle.
As a reminder, for all the latest official information, visit coronavirus.maryland.gov. We leave you tonight with a virtual America the Beautiful. This was put together virtually by the men's and women's glee clubs of the United States Naval Academy. For all of us at MPT, thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
Programs on MPT are made possible by our members and the following.
Hello, I'm Anirban Basu, CEO of Sage Policy Group. Our economic consultancy has served clients in more than 40 states and in 6 countries, but we're proudest to call Maryland home. Join us in support of one of Maryland's great treasures, MPT.
71 acres in downtown Baltimore devoted to learning, discovery, care, and service. We train the professionals who secure the health, well-being, and just treatment of Maryland citizens. We create the knowledge that cures disease and strengthens communities across the state and around the world. UMB makes the world more just, more enlightened, healthier, and more humane. We are UMB.
Join a banquet of